Okay, so did we finish all the cervicals? No. Bring your chin to your chest. I'm going to press down now. Is that going to be all right, or does that bother you in here?
No,
does that hurt?
Okay.
Adson's, right? Or Sotol. Adson's.
Oh, yeah.
Adson's. Okay, so that's good. I did some orthopedics. Now I'll just watch his range of motion.
Just show her.
Yeah, whatever you need, man. Turn your head all the way to the left, all the way to the right. Come back to the center. Look all the way up to the ceiling.
It's just in German.
Okay, that's not good enough. Now bring your chin to your chest.
And then instead of
All the way down. Is that as far as you can get? Okay, come back to the center. Your neck doesn't move too well. Have you had some accidents or falls in your past? Hit on your head? Jump into an empty pool? Did you play football, wrestling?
So it's
I wrestled for a couple of years and then ran cross country and track and field.
Did they ever drop you on your head in wrestling and things like that?
Not
No, okay. But you've had some trauma to your neck because it doesn't move the way it should. Okay, stand your back for me. Good. Alright. Most people do a straight leg, or is it wrong? Sometimes they let the patient raise the leg.
Yeah.
We do it. Give me the weight of your leg. I'm just going to raise it up. You let me know if you feel any pain, tingling, numbness. They're supposed to get to here without any pain. You're pretty flexible. That's pretty good. And how's that feel? Is it stretching here? Any pain in your low back?
No.
How about if I do that? Go right to, what's that, braggarts?
Yep.
Relax, totally relax. Oh, the other thing is you're supposed to hold it. They should be able to not only go to 90, but hold it for 30 seconds while you talk to them. And then you do this and hold it.
There's the braggarts there, huh?
Yeah.
Yep.
And if they can't deal with it because it's putting pressure on the nerve for 30 seconds, if any pain comes into the leg or the lower back, it's positive.
Even if it goes into the leg.
Yeah.
Okay.
Yeah,
I
so
only thought of lower
straight
back.
leg and braggarts are almost positive on like 80% of the people that come in.
Yeah.
You know? Other side.
And most people can't get to 90.
Same thing. Most people can't get the 90. You're pretty good. And you hold it. Don't forget to hold it. Sometimes I'll put it right over my shoulder and just have a chat with them.
Mm-hmm.
And then say, how's this right there? Can you handle that?
No.
Just let me know if it gets, oh, sorry. Okay. Let me know if it gets too much. Sooner or later I do shut up. Okay. And then right into our old friend Legs. I'm going to cross your legs. Totally relax. Drop it down. Any pain or tingling in there? Problems in there? Okay. Other side.
It's for bear.
Right in there.
Patrick for bear.
Legs. Oh, Faber Patrick.
Yeah.
Yeah.
What's Leg?
I don't remember.
Faber Patrick.
Okay, I'm going to raise them up.
Let me get these
Now
right.
you hold them there. Can you hold them there? Milligrams. Okay, good. If he drops, positive milligrams, right? Disc problems. Yeah. So we did get positive straight leg raisers. So we know we can do lower NCV. We know we can do, well, we'll get around to the injections in a minute. What else? Supine. That's it. Go ahead and lay face down for me now. Got some room for your nose there. All right, totally relax. I'm going to put you through some more range, some more motion here, and just let me know if there's any pain or problems at all. I'm going to bend your leg, bring it up, that side joint. Any problems here?
No.
Does that hurt at all?
I start to feel it a little bit.
What's that? Knockless?
No, necklace is to the butt.
Is
All the way like that?
Necklace is.
Maybe
necklace
Eli's?
is straight this.
Maybe-
Eli's is a cross.
Oh, Eli's external. E for external.
Okay.
Oh, is that you went to the opposite?
Yeah, and then Yeoman's.
Yeoman's, there you go, that's right.
This
No,
is
this is Yeoman's. here.
This is Yeoman's.
Yeah,
This
that's
is
Yeoman's.
Knockless. And this is Eli, right?
Yeah, this is Yeoman's.
All right, good. This is
This
good
is
for me too.
necklace. And I think Eli goes to the opposite buttock.
Really?
Yeah.
Okay, you might be right.
Yeah, he's studying for part 4, so you might,
Okay,
not want,
good.
you might not want to mess with him,
I'll
Tim.
listen to him. All right. Bring it up. Any problems? In and out. You guys get the point.
Gotcha,
We're looking
yep.
for positives, and we actually do the test to the full range of motion, you know?
Yep.
Okay. There's no other orthopedic tests face down, but I'm going to take the opportunity now to check for trigger points.
Trigger points, yeah. Straight with you.
Tender at all on either Achilles tendon there?
My right one.
Right one's sore. So now I just know I got
You know
a
you got-
sciatic nerve.
Sure you do.
Bam, right in the middle of the gastroc. Boom. Feel that?
Yeah.
Tender, isn't it?
Yeah.
How's this one right here? Can you feel that?
That was not too bad.
Not too bad?
Yeah,
Just
no.
gotta find the right spot. It's there. And then over to the medial, or gluteus med. Feel that there?
Yeah.
Tender there. So now I'm gonna go to L5.
Mm-hmm.
Almost everybody's gonna say hello. Right?
Yeah.
Can you feel that? You
Yeah.
got a disc problem, my friend. And I know that because there's swelling and misalignment on that joint there, and you got pain and tenderness all the way down your leg. That's a 4-foot nerve that's inflamed. Dramatic pause.
Yeah, do you really?
Pause.
No.
Okay. So then we'll just keep going. How's this side? Any pain or tenderness in that butt cheek there? There's the trigger point right there. Can you feel that one there?
Yeah, that's worse than I
And you can feel that one there, and that's worse than the left leg. So both sides, we got a sciatic nerve that's actually inflamed all the way down. That's a 4-foot nerve, as thick as your thumb, that's inflamed. Okay, let's move up the spine a little bit. So I got a chart of the human body, and I'm Xing trigger points here.
Yes, I've seen.
Here,
Yep.
here.
Yep, we have that
Here,
form.
3 here, and now the sacroiliac. Any tenderness here? Either side tender?
So you'll have like a clipboard, and you'll be just while you're doing it.
Yeah, right over there.
Okay.
So sacroiliac joints feel all right then. We just got heated L5.
Yeah.
How's this one there? Number 4. Sore 2. Number 3.
No,
2. Okay, so you got a couple disc problems in your low back. That's pretty serious. Now we'll look for some more trigger points on this side and over here. Feel that right there?
Yep.
Okay. Another trigger point.
So you're just going paraspinal musculature.
Yep.
Try to make it one
And
word
right
out of
in
it.
here.
Yeah.
Every chiropractors are real good at
Oh.
finding that right there.
Oh, yeah.
Piece of cake. Everybody's got one. Let them know it's there. Okay. More misalignments in your mid back. I'm not surprised because whenever you have a misalignment or a disc problem here, there's usually one in the mid back as a compensation. This one goes left. This one goes right. See how I'm making them feel it kinesthetically.
Yep.
And then into the rhomboids, trigger points all over the place. Just let them know they're there. There's another one, there's another one, there's another one. Sometimes you have the opportunity to have a second person in the room and you can communicate to them, which is great.
Yeah, sure, it would be.
Subscap,
Use an intern for that.
subscap, infraspinatus rather. And another one right there. And then we'll do some traps. We already looked at a few of those when he was
Seated.
seated. So we're good. Okay, come on up. That's it. We're not done, but I'm just going to ask you at this point, doesn't it feel like you got some problems?
Yeah.
I mean, as from a patient standpoint, you're like, God damn.
A lot more.
First of all, I've been touched. You know you've been touched. And you know you got some problems. So now it's like, okay, looks like we got some work to do. Okay? We found some inflammation in your low back. We found not one but 2 disc problems, right? Which is creating inflammation down both your sciatic nerves. So we're going to have to do some further testing to see exactly how bad that is. Okay? We also found some problems in your both wrists, primarily this one concerns me, this elbow and this shoulder. Okay, so we're going to do some more testing there. I actually want to get an x-ray of this wrist and that shoulder. Okay? And I think that a lot of that is coming from some subluxations. That's the word we use for the misalignment in the vertebra and the neck, causing nerve interference here, making these joints weak. Does that make sense?
Oh,
That
yeah.
if this nerve isn't working, that it could cause problems here?
Sure.
Okay, so we got some trigger points. That's where the muscles get all bunged up into knots. It's causing your shoulder to shorten up, because if you got an 8-inch rope, you tie a knot in it, it becomes a 6-inch rope. That's what's happening here. That's why you got one shoulder up here and things aren't working right. Okay? So we got a few things we got to do. We're going to do some further testing. Okay? So let's go take some x-rays. You have any questions so far?
Not at all.
Do you feel like there's anything we haven't discussed or anything we haven't talked about, anything we haven't addressed? Okay, very good. Let's keep going.